people, and it's gone on far too long.
My name is Lyndia Lou Nicholson. Much has changed in all of our lives since COVID-19 began its rampage through our country. One thing that hasn't changed, though, is the disrespect that I face as a poor person. I'm 64 years old, and for the first time in my life, I earn more than $15 an hour. And that's only because of the additional $2 an hour I earn now as hero pay in my essential job as the pharmacy technician. Since I declared bankruptcy in 2019 in order to save my house from foreclosure, I've had to make monthly payments of $1,440 a month. That's $1,440 a month for my combined mortgage and bankruptcy payments. After paying that bill, I barely make ends meet. My utilities are as low as I can get them, and I have no health insurance. I didn't sign up for Medicare Part B because of the cost. You've looked at a certain way when you're poor. I've seen this since I was a child, raised in Dayton's premier public housing, DeSoto Bath. All my life, I've been told that people like me do not deserve basic dignity and rights. Even other African Americans look down on poor Black people. There's a stigma that comes with being poor, a disrespect that spills into your family life. My only child, a son who's 35 years old now, doesn't speak to me. I think it's because he wants to be part of the American culture that likes to own things, be rich, have the best car. I don't fit in with that life. I can be exposed to the virus when I ride the bus to work and when I'm on the job. I do all I can to protect myself, but I don't know what I would do if I get sick with the coronavirus because I don't have health care. I really love my job, and I'm glad to have it. But this country needs to treat its workers better, especially its older workers. This is why I'm part of the Poor People's Campaign, a national call for more revival. I want to be part of a movement that's fighting to create a just society for all, and that the mission of the poor people, and that is the mission of the poor people. And that is why I'm testifying tonight at this digital mass meeting, this along with other impact people from 3 other states. Reverend Barber, co-chairman of the national campaign, said it's fuses and wounds of inequality in America that were open and given entry to this pandemic. We need a real rescue package that helps everyone, especially the 140 million poor and low wealth. Congress passed bills that totaling $3 trillion, much of it going to big corporations, but workers barely get a crumb. As Reverend Barber says, we need health insurance for the uninsured and paid sick leave for all. Those are some of the reasons why Congress must pass a bill that helps people such as myself. All my life I've been told that people like me do not deserve basic dignity and rights. But in Ohio, 34% of us are poor or low income. That's a total of 3.8 million residents, including 33% of white people and 61% of Black people. Even though I feel depressed at times, I'm going to keep pushing and keep fighting with the Poor People's Campaign until minimum wage reaches $15 an hour. We can't survive on low-paying jobs. Workers in this country should earn a living wage. Reverend Dr. Liz Sorhes, I'm sorry for mispronouncing that name, co-chair of the National Poor People's Campaign, it's becoming clear in this pandemic that most essential workers in this country are done by those of us who earn the least. The number of poor people is increasing in an economy that relies on non-unionized, low-wage work and part-time work, she says. We are truly are relying on each other now.
But Linda, I want you to say something again that the world needs to hear, because I don't want folk to miss it. You said that this is your first time making over making $15 an hour.
That's true.
Now you mentioned your age. I didn't mention it, so I'm not. I don't get it, but you don't mind. I want you to say that again. Would you say it?
I'm 64. I'll be 65 May the 10th.
Yeah. And then you said, if I'm not mistaken, you said that that's only because of the hero pay. So it took COVID-19 for you to even get to 15. But then when you get to 15, because of the way this nation is structured, you still don't have health care.
Still don't have health care.
Because health care is tied to a job and is not tied as a human right. I want folk around the nation to hear that and understand why we are not playing. That why this movement has a certain level of righteous militancy. What these stories that you are hearing should not exist in the wealthiest nation in the world. Thank you, Lynda.
Somebody's hurting our people, and it's gone on far too long, and we won't be silent.